Hi students, welcome to this session that is about your roadmap to choose a correct branch. Okay, so I'm Dr. Gaurav Patel and I'm here to talk about surgery as a branch in post-graduation. Okay, so see, first of all, I would like to congratulate you for the amazing ranks you have got in the NEETPG exam. Okay, so NEETPG is, we all know that it is a difficult exam to crack, and all of you who have got the rank and sitting here listening to this counseling session, it means obviously you all are winners. Okay, so let's talk about when we talk about the branch as a surgery, medicine, these are the broad specialties, and when we talk about surgery as a branch, general surgery as a branch, like what are the pros and cons of this branch, and there are no cons in any branch, but still let's see as compared to the other branches, what are the advantages of few things which are in surgery as a branch. If I say, see, there are certain branches which need lots of hard work, and surgery is one of them. Okay, so up to this, like in your MBBS, in your internship, and maybe post-intern, if you're doing some work, that was the easy part. I'm not saying that this is like your residency is a difficult part, but this is something now the serious business starts. Okay, because you will be dealing with the patient. Many times you will be the only one who will be like writing the treatment and deciding the surgery or not to do surgery for a particular patient. Okay, so basically you are dealing with life and death when you will take the branch like surgery. Okay, so now if we see as a branch surgery, this is, I'm not, maybe you can call me a bit biased because I'm a surgeon and I'm practicing surgery for the past more than 10 years. But if you ask me my personal opinion, there is no branch which can be compared with surgery. Okay, the amount of satisfaction, okay, the adrenaline rush, and the joy which you get in going to the OT and scrubbing in the case, doing the surgeries. Okay, and then you'll see follow up the patient in the post-op period. You will see the patient is getting discharged, they are getting cured. That is something which is only the person who has experienced these feelings, only that can explain how amazing it feels. Okay, you can say it is the best feeling in the world when you operate on someone, maybe a trauma patient, maybe a malignancy patient, and when they are saved, when they are going home, and the amount of satisfaction which you'll see in the patient eyes, and that satisfaction when you feel yourself, that is the best feeling in the world. Okay, so because surgery is a branch which provides cure to the patient, and like one day the patient was deceased, the next day the patient is free of disease. This is something which makes this branch really, really amazing. Okay, so there should be no confusion. If you have thought ever that, okay, you will take surgery, you will become a surgeon, believe me, take this branch, you will never regret it. Okay, now I can see the chat box. Santosh Kumar is here. So welcome Santosh, and welcome all of you who are there looking at this session live. So any kind of question from your side is most welcome. Okay, so surgery as a branch, if you see the amount of work which you have to do in the residency, that may be more from as compared to the other branches. But when you go inside, maybe initial 15 days, maybe a month, you will feel a bit overburdened. But as you work 1 month in that branch, from the second month, you will think that, okay, this is your life and this is what you're supposed to do. And you will never feel that this work is a burden. Okay, you will love your work. You will enjoy, working in the ward, and you'll make friends there from the other departments, your seniors, your juniors, everybody. It is like a family. Okay, because for the next 3 years when you'll do the residency, and maybe after 3 more years when you do your senior residency, or maybe when you'll do your MCH, the hospital is your main home. Okay, because you will be spending 80% or at least 70% of your time in the hospital. So that will be your family. Okay, so Okay, these branches, Suraj, these are the things which I think that I'll be discussing. Surgery as a branch in general, then whether MS is better or DNB is better, government versus private colleges, doing the post-graduation from a metro city to a peripheral college, 6 years DNB, hands-on versus academic, and regarding the bond, stipend, and options after general surgery, whether MCH is necessary or not, and if not MCH, then what are the other options? And if you want to ask what are the books you need to read in your first year. So these are the things we'll be discussing. Okay, Abha, it's very nice to know that you want to become a surgeon. So, okay. Branch has no work-life balance. Please tell me about it. Okay, so, let's talk about this work-life balance. Okay, so this is something which is totally dependent on the person. Okay, it's not that the branch is asking you to do more work. Okay, I have seen people, I have worked in the hospital also, and my personal life is also good. I used to take time for myself also. Okay, so it's totally depend on which kind of person you are. If you are like a person who is disciplined, then you will be finishing your work on time. Then you have the other things. You have the time to, give time to your family member, and you can go out and you can watch movies also at times. So work-life balance is totally dependent on the person. I have seen people who are like, even if they are free, they will be like sitting in the wards and doing nothing. So few people, they feel more belong to the ward. Few people, they just do their work and then they go out. But at times, because you are the responsible person when you become a surgeon. So even if you are like outside, and suppose you get a call from the hospital and you are on call, so wherever you are, you have to go to hospital, okay? Because this is a branch which deals with life and death. The delay can cost, a major difference in somebody's life. So make sure that even if you are in your residency, you are going out for some, maybe some dinner, some lunch somewhere. The moment you get a call, you have to report. Okay, you have to report back to the patient. Okay, hospital will be our family. How our personal life will be. Hospital will be. See, this is what you need to balance. This is totally depends on you. Okay, in general, I tell you, in surgery, when you will take the first year PG, in the morning, you have to be in the ward by 7 a.m., maybe 7 to 7:30 a.m. You'll reach there. Okay, so after that, you will take your own rounds. Okay, the PG rounds. Then the senior residents will come. They will take their rounds. After the senior resident rounds, now there will be, either there will be some consultant round on the grand round day, or it will be a OPD day, or it will be a OT day. Okay, so these are the things after that. So mostly in your first year PG, after the consultant round or after the rounds, you have to do your work. Okay, in the OPDs you will do when you will finish your ward work, then they will call in the OPD. OPD you will go, you will see how they are looking at the patient, what kind of history they are asking. Okay, what are the different investigations? These things you need to learn on your own when you go there. That, okay, where is the radiology department? Where is the pathology department? Where is the microbiology department? You will make some friends also, maybe your colleagues or senior also, so that at times when they ask you to get the report, you can maybe ask them on phone, you can bring the report on phone and you can tell them. Okay, so you need to make this personal rapport with your, the other departments also, because in surgery you have to deal with other departments. You need to collect reports, you need to do other things. Okay, in the OT, don't expect that, you are joining your PG and the next day they will call you in OT and then they will ask you to perform a surgery. Okay, you might not be able to, they might not let you wash or scrub in the case for maybe initial 3 months, 4 months, but you don't have to, think too much about it. All you need to do in the first year residency, just remember one thing, just do what your seniors are asking you to do. Okay, no matter you find that very, very easy work or very difficult work or impossible thing, just try your best to do whatever you have been asked to do. Okay, if you do that, your seniors are also looking at you like every day. They will see how you are working, whether you are following the orders or not, and how good you are in fulfilling that thing. Suppose they ask you to make this patient fit for a surgery, some major surgery, and if you are doing your best and the patient is fit for surgery, it is kind of your win also. Okay, so they will see that, okay, this person is good, this PG is good, and whatever we ask him or her to do, they are doing that thing and they are making the things work in the ward. Next time when you'll come to the OT, they will themselves ask you to, okay, go scrubbed in. Then they will ask you to see, then they'll ask you to assist. And one fine day, they will ask that, okay, you have done enough, now come on this side and this time you perform. Obviously, you will perform under the supervision of somebody, but by the time you'll come in your third year, there are many surgeries which you can do on your own, and many things which you will be teaching to your juniors. Okay, yes, Muhammad Ashar, you don't know anything about surgery except theory. Yes, if you know theory, that is more than enough. And even if you don't know theory, if you love the subject, if you have the passion for the surgery, believe me, when you enter inside, everything you will learn in those 3 years. Okay, so let's see, like as a branch, if you have any question. Okay, let me, because I can see many girls are also in the chat box. So girls in surgery. Okay, girls taking surgery, believe me, the scenario these days is not like it was like 15-20 years back when people used to say that girls should not take surgery and there is bias in surgery or orthopedics. This is mainly a branch for boys. There is nothing like that. Believe me, these days in all the good colleges, government colleges, if there are like 10 PGs joining in 1 year, out of 10, 3-4 girls you will see in almost all the colleges. Okay, so this branch is not, you can say it is not a gender specific branch. Girls are doing very well in surgery. They become very good surgeon. They become like head of departments, and even when they go like in the corporate or in the private practice, they are doing very well. Okay, the only thing is, certain branches, like after your general surgery, there are certain branches which needs more labor, like neurosurgery. Okay, neurosurgery will get call at 2 a.m. in the, late at night. So then you have to go there. Certain things are there, but like few branches after the general surgery, like plastic surgery, pediatric surgery, I have seen so many females who are doing these branches and they are doing amazingly well in those branches. Which colleges? Okay, now I'll come to this thing. Scope. Okay, before that, let's see MS versus DNB. MS versus DNB. Okay, so both the things have their own advantages and disadvantages. MS is, see, in the MS, when you do MS, the exam will be, in both the things, the exam will be after 3 years. Okay, in MS exam, it is relatively easy to pass as compared to DNB. Okay, because the exam is easy to pass. I'm not saying in DNB that it is very difficult, but if you have read during your preparation and if you have worked, if you have listened to your professors, then even in DNB, the passing rate these days are much better. As it was like 10 years back, the passing rate was like 20-30%. But now if you see, the passing rate is almost 80, more than 80%, at some certain institutes, 90%. Okay, so the only disadvantage is that you will not get, your exams will be somewhere totally a different institute. Okay, so you will not get the advantage of your home center. Okay, it will be somewhere, your external examiners as well as the internal examiners will be totally different as compared to the MS, where the internal examiners are mostly your own professors, your own faculties who are knowing you for the last 3 years. So obviously they will support you in the exam. If you have worked well in the last 3 years, they will definitely support you in clearing the exam. Okay, so exam is easy to pass. In DNB, one can see hands-on experience is less as compared to MS. Okay, but academics are a bit better in DNB. Okay, because when the hands-on experience is less, you will have more time to study, you will have more time to research. So academics are better. In both MS and DNB, nobody is going to teach you like you have been taught in your MBBS exam. Okay, it is like you learn on the patients, you will learn on the rounds, you will learn on in the OT, in the OPD. So that kind of learning process, okay, the learning process is totally different in the undergraduate training and in the postgraduate training. Postgraduate training, you learn on every patient, every case. It will not be like a formal classroom. There will be some classroom teachings like journal club or the seminars, but believe me, people, they don't learn that much in those theory classes as compared to what you learn in the practical things. Okay, and there is, these days you can say there is no difference in getting the jobs, no difference in the MCH entrance, or no difference in any fellowship. Okay, there is absolutely no difference. These are considered as equal at all the levels, because like 5 years back there was some problem, like those people who want to join as a faculty in the government colleges or even medical colleges, they were asked to do at least 1 year of senior residency from a college where MS is there. But now there is absolutely no difference. Okay, that you will be treated at par with the MS. And in fact, if you ask me, in the MCH entrance exam, I guess DNB people are cracking and they are getting better ranks in the MCH entrance exam, because obviously they are more focused academically as compared to the MS people. Okay, so MS versus DNB, there is absolutely no difference, but still I prefer, if you ask my personal preference, preference is this. Okay, like if you ask me the preference, my preference would be MS from a government college. Okay, then DNB, and then MS from a private college. Okay, so this preference is better. Like there is slightly, you can say, MS from a maybe a peripheral college, and which is not your state, somewhere other part of the India, and DNB in your state, and that college is not one of the top colleges, then you can say that this, you can take it DNB in those cases. Hands-on compensation, Ishank, in the DNB, this is, see, after you do the DNB, even if you ask me in the MS, when they clear the exam after the degree, they are not very good surgeons. Okay, because they will be something they will get hands-on, but most of the things, all the surgeons, they will learn when they finish their 3 years of PG and they do their senior residency, or maybe when you go for the MCH. So that is the period when you learn the most. So hands-on. Okay, so don't worry about the hands-on. Just see that in wherever institute you are going, the people there are good and they are doing variety of cases. They are doing minimal access cases, laparoscopic surgeries. Okay, so that when you go there, you have to see like maybe 100 cases. You have to assist maybe 30 cases, and you have to do maybe 5 cases. So this kind of learning is much better as compared to you are doing 50 cases, unsupervised, no matter how you are cutting, whether it is a good way or bad way, how you are holding the things, how you are holding the sutures, how you are holding the instrument, how you are talking to the patient. So that unsupervised access work is never good as compared to a good supervised, maybe a little bit less work, but under the supervision. So you have gone there to learn. Okay, you have not gone there to work. There is a whole life there for you to work. Okay, you will be working whatever, like 40-50 years or more than that. After that, the whole life you will be doing surgery only. That 3 years is to see how to do the things, how to talk to the patient. Okay, so that is the main thing. Should you stay in the India or UK? Okay, so MS, DNB, MS is always preferred over DNB, but yes, in those cases where you are getting the MS, maybe in a private college or in a peripheral institute, then in those cases DNB is a little bit better, and you can go with DNB and just work with your full heart, and when you will pass the DNB, you will do your MCH, and it will be like the life is right in front of you. Okay, so after general surgery, what are the options? See, three main options. One is you will do MCH. You will do MCH. So when you do the MCH, there are certain branches which are obviously difficult to crack, but believe me, MCH entrance as compared to the NEETPG, MCH entrance is less stressful. It has competition also is less because it depends totally on which branch you are wanting to choose. Okay, like if I ask you what are the top competitions: GI surgery, urology, surgical onco. These are the three branches which you will see having maximum number of people. They will be taking these branches. Previously, there was separate entrance exam for these, but nowadays there is a single entrance test. There is NEET MCH or NEET Super Speciality, where you have to give just one exam, and then depending on the rank, like in this case, you have just one NEETPG, and then now depending on the rank, you are choosing surgery or maybe medicine or maybe gynae. Like that also in Super Speciality also there is just one exam, and after the rank, you will choose like whether you want to do GI surgery or urology or onco. So these are the main branches. Neurosurgery is, okay, neurosurgery, plastic surgery. These are so not much competition in this. Suppose today you will say that, okay, I'll take surgery and I'll become neurosurgeon. You will become neurosurgeon. But suppose today you will say that, okay, I'll take surgery and I will do MCH GI surgery. Then I will not say very affirmative that yes, you will take GI surgery, because there are very limited seats and so much of competition. But these things, sooner or later, you will definitely get this. Now we are left with pediatric surgery, CTVS, okay, vascular. These days, like there is breast surgery also in the AIIMS, they have started this branch. Okay, so these branches, you will see that not much competition is there. Okay, all you have to do is just fill the paper. Suppose you want to become a pediatric surgeon, you will definitely become, and that too in your first attempt. CTVS, if you ask me, it looks very, it looks quite glamorous that, okay, you are cardiac surgeon and you do open heart surgeries, you'll do this, that. But believe me, when you go and when you'll work like 1 month, 2 months, when you are PG in your second year, you have this peripheral posting where you'll go in the subspecialties and you will get experience with these branches. You will understand that, okay, how glamorous it looks from outside. Actually, it is not that glamorous. It takes too much there is a long time for settling up. Okay, after doing the CTVS, at least 10 years, 15 years will pass. Then somebody will allow you to do a bypass surgery. And these days, so many procedures cardiologists are doing. So that's why if you have the passion, I'm not saying these branches are bad, but these are not as glamorous as it looks from outside when you go inside and when you'll work in these areas. Okay, so this is Ishank. I'm talking about the CTVS only. Okay, so now somebody's asked, okay, 6-year DNB. Very important thing I want to explain you. 6-year DNB. What are the branches where it happens? Okay, neurosurgery, plastic, pediatric, and CTVS. Okay, so only in these branches. And I told you that these branches are those branches where the competition is not that much. Okay, so instead of going for 6-year in these branches, it's better you do 3-year MS or DNB, and then you will do 3-year in these branches. That is much better as compared to a 6-year direct DNB in these cases, because Suppose, like I said, somebody asked, okay, what about CTVS? So suppose you take CTVS, and in your second year, you feel like, okay, this branch is not good for me, and what I thought, actually, it is not like that. So now you will feel about, dropping from this, and then you will give another exam, and then you will pass again. So basically, you will be like 2-3 years, you will go back. As compared to when you do your 3-year MS or DNB, you will have the experience, the first-hand experience of these branches. And if you like these branches, like I said, just give the exam. You will get these branches in Delhi itself. Okay, in the top colleges, you will get these branches that I can give you in writing. So instead of, suppose there was 6-year DNB in GI surgery or oncology or urology, then I would say that, okay, you can take these are good. But unfortunately, there is no 6-year course in these branches. Okay, in these branches, there is no 6-year DNB. Because these are the competitive branches. So in these cases, if there is 6-year DNB, then I would have said that go for it. You will never regret. But now for these branches, which are otherwise very, see, suppose, like, one more thing, suppose you will do 6-year DNB. Then you will become what? DNB neurosurgery. And if you take, suppose, 3-year DNB general surgery, and then you will become directly MCH neurosurgery. So that appears much better. I mean, it looks much better as compared to 6 years direct course. And in your general surgery, you will have experience of the other things also, which you will not get in these things. Because in these things, although they will send you for some general surgery experience, but hardly for 6 months or 1 year. Like for 5 years, you will be doing these things only. So I would not suggest to go for these direct 6-year courses. Peripheral AIIMS better or peripheral government better? See, between the peripheral AIIMS and the central institutes are better. Between the peripheral AIIMS and the peripheral government colleges, peripheral AIIMS is better. Okay, so you can see this is better than this, and this is better than this. Okay, bedaquiline at the rank 1289. If you are, thinking about taking surgery and BJMC you are preferring, you will get BJMC. But at this rank, you will get the colleges in Delhi also. So this is what I know that, I have so many friends. I had junior also from the Gujarat. I know people of Gujarat, they are not very keen on, going out of Gujarat, even for like 3 years. Gujarat is their comfort zone. But I would still say that as a surgeon, surgeon is not only you will become somebody who is cutting open the patient's body and doing the things. As a whole personality of a surgeon, if you see surgeon in the hospital, you can, without talking to them, just looking at how he walks, how he's talking to the other people, you will know that, okay, this person looks like surgeon. There is a different attitude, different personality, that fearless attitude. So I want you to become that kind of person who are fearless. I mean, you are obviously scientifically, you have to be correct, but you have to be that bold, that fearless. And when you go out, when you step out from your comfort zone, then you will learn. So if you're from Gujarat, when you come to Delhi, when you go to Mumbai, you will learn lots of things. You will meet lots of other people from other areas. And believe me, the amount of learning, not the academic or the surgical learning, the in general learning will be much better when you go out. Okay, so if you're wanting to go to BJMC, you will get, but believe me, try other states also, and you will not regret it. 1700 rank, Karan. Yes, you can get Delhi and Mumbai. Okay, maybe not the MMC or the VMMC, but yes, RML maybe, RML also less likely, but Lady Harding you can get. Okay, in Mumbai, some colleges you might get. Okay, Ishank, 15,000 rank, which hospital in Delhi? Okay, I'll tell you about something about that DNB. Then we'll discuss the other things also. Suppose DNB, how to choose. How to choose the DNB. Certain things you have to see. Okay, the state, the language. Okay, suppose you are from North India, then I would not suggest you go and do DNB in South India. Suppose you are from South India, don't come to North India for the DNB, because at your rank, you will be getting the same kind of college in the North India as well as South India. So first thing is stay in your region, not exactly in your state, but at least in your region. Second thing, always prefer government hospital. Government hospital, medical colleges. Then you go to, there are certain semi-government institutes, trust hospitals, and then you'll go to private hospital, and maybe in the last, corporate. Okay, so this should be your order when you want to choose or when you want to fill the DNB preference. Okay, passing rate these days is good in almost all the colleges, but still it is always better if you have any senior in that college, just ask them about the passing rate. But I would suggest that don't think about the passing rate. These days passing rate is good in all the thing. Okay, and in the government hospital also, BHU is better. Okay, Ramkishore. UK versus India, Suraj, I'll come to it. Okay, I have so many friends, they are still working in UK. There are few people who came back to India, so I'll come to it. In this also, railway hospitals are good. In Delhi also, if you ask me, this railway hospital is good. In Delhi, if you want to ask me, I'll tell you few hospitals like Ambedkar Hospital is good. St. Stephen's is good for surgery. Hindurao Hospital is good. DDU Hospital is good. Gangaram is good. Like Gangaram, academically, this is you will see this Gangaram will be the top institute which will be filled in Delhi. But hands-on, you will get better in these hospitals as compared to Gangaram. But the quality of cases, the variety of cases, what you will see in the Gangaram, that is much better. Okay, but I would suggest that if you are not getting Gangaram, these institutes are very good institutes in Delhi. Like I said, Northern Railway Hospital, NRCH. This is one of the very good institutes for DNB, Northern Railway Hospital. Sanjay Gandhi Hospital, which is in Mangolpuri, that is also good. So many cases are there. Academics are not that good, but otherwise it is good. R&R in the army, that is good. But if you are choosing for R&R, make sure you are physically fit. Okay, because they do this medical quite, seriously, because in the other hospitals, the medical might not be that serious. But in this army institutes, if you are going, they will do serious medical. And even if after you are, allotted the seat, and if they find you medically unfit, they will debar you. Okay, so you cannot do those things. So if you have anything, like suppose you have got the LASIK done, or there is, a flat foot and all these things, better do not prefer army. Okay, if you are looking for army, specs is not a problem. Okay, if you have specs, maybe 3-4 numbers, something like that, that is absolutely okay. But if you have got the LASIK done for it, don't go there. Okay, flat foot, don't go there. Some heart problem, some lungs problem, asthma, don't go. Okay, so R&R, army institutes, if you are filling, make sure that you are quite fit. Okay, then after these institutes, then I'll say that, okay, Max Hospital, Saket, Fortis Hospital, BLK, Action Balaji, these are after these things. After you get the government and other things, then you'll go for these things. Private hospital and corporate, see, like this corporate hospital, just consider corporate hospital, we have where they have lots of branches, like Max Hospital. They have so many branches in Delhi, outside Delhi. Fortis, this is corporate. BLK, this is corporate. Okay, so these are corporate hospital who have so many branches. So in the corporate world, the things are more of business driven rather than the teaching driven. So there the things are a bit different. But suppose there are certain people in our face-to-face counseling session. There are few students. They came and they asked me that we want to work in the corporate setup only. Later part also. So if you have very clear idea that you want to work in the corporate setup, then you can take these hospitals. So you will be following the same culture throughout that life. Okay, suppose somebody goes from a government hospital, a big government hospital, to a corporate, then there will be lots of the social difference you will find in that. But still, I'm not saying these hospitals are bad. They do very nice cases, variety of cases. But yes, you will not get hands-on. Very rarely you will get something in these hospitals as compared to maybe a Hindu Rao or the DDU or Ambedkar Hospital or the Railway Hospital. These are better. Okay, you are from UP, then why to stay in Gujarat? Okay, AMU and BHU always you prefer BHU over AMU. Okay, BHU is any day better. In Delhi, which college to prefer first for MS? So in Delhi, if you ask me about the MS, I mean these are my personal, the opinion. This might be different for other people, but if you ask my opinion, in Delhi, when you talk about the MS, VMMC, MAMC, they are like equally good. Okay, if you are a undergraduate from VMMC, stay in your institute. If you are an undergraduate from MAMC, stay in your institute. Otherwise, both are equally good. RML comes next. Okay, then UCMS and Lady Harding. Okay, so even RML is also, you can say these three are almost like each other, not much difference. So these three are the top, then UCMS and then Lady Harding. Options after MS, after MCH. Okay, I was talking about it. Okay. So MS, one option is MCH, another is MRCS. So now we'll discuss this MRCS and your, the ticket to UK. And somebody was asking this ticket to UK. I have 9369 rank general. Is it risky to wait for mop-up round? Yeah, as Anvin Jose, I would suggest that if you're getting a good DNB seat, you take that. Don't wait for the mop-up round. Okay, if you have got the rank, like if any one of you have got the rank within like 14,000-15,000, you are getting MS or DNB this year. Believe me, don't wait for the next year. Just take it. Okay, there is a long journey. There will be MCH also. So suppose you have not get a chance to get the MS from a very good college, maybe you will do MCH from a extremely good college, and after the MCH, nobody will ask you from where you have done your MS. Like after the MS, people, they don't ask you from where you have done your UG. Okay, now when you are in MBBS, they don't ask you how much you got in your 12th or in the 10th. So this is the same thing. When you just do your basic post-graduation in the surgery, and after that you can do MRCS, go out and you can do MCH and go in that field. So dropping a year, if you're getting a seat this time, is something which I would not suggest. Okay, so MRCS is basically a membership exam for the Royal College of Surgeons. Okay, there are three types MRCS in the Glasgow, MRCS in the Edinburgh, and MRCS in the London. There are three colleges, and this MRCS exam. So MRCS is a good option. Okay, after MRCS, there are two steps. Okay, Part A and Part B. Part A you can give. Part A is basically the basic sciences. Okay, they will generally ask about the surgical anatomy, some physiology related to that, some pathophysiology related to that. So this is very exam you can give at your end of second year PG or at the beginning of your third year PG. And Part B you give after the MS or DNB exit exam. After you give your exit exam, that is the time when you give part B, because part B is more of clinical. So when you'll read for your MS or DNB practical exam, after that when you'll give, it will be much easier for you to clear part B. Okay, so after MRCS, now you can go to UK, you can go to in many areas in the Europe, you can go to Middle East also. Okay, the people who are having MRCS, they are more preferred in these areas. Even recently somebody said that in Australia, New Zealand also they consider these things. Okay, so you can go there and you can work. You can go there and do fellowship, and then you can come back. Okay, there are lots of fellowship, minimal access surgery, robotic surgery, bariatric surgery, oncology, transplantation. So many fellowships you can do, and then you can come back in the India as a the fellow in that particular branch, and you can work here and you can maybe have your own setup. PMCH, Shubhangi, is yes, very good. In Bihar, if you ask me, two good colleges for surgery, PMCH and Darbhanga Medical College. These two are good colleges for surgery. Okay, obviously it is good. PLAB route or MRCS? MRCS. Okay, PLAB is not, MRCS is something, because when you do the MRCS and when you'll go there, you will be considered as a surgeon only. But if suppose you do MRCS and you want to go to US, then they will consider you as a simple graduate. Okay, they will not consider this surgical degree as their, the surgical equivalent. So MRCS, when you go to the UK, you will be surgeon only. And after MS, if you want to go to US, you will be nothing but a simple graduate there. Yes, MRCS, you don't have to do too much of preparation. Nishank, MRCS is, I'll tell you, if you have any doubt, you can message me. MRCS, there is a app, there is a basically question bank, eMRCS. Okay, you have to take the subscription for maybe 6 months and 8 months. So after you fill your first step, the fee, then you take this eMRCS. There are 2 books, Raftery, that is for the basic sciences. So all you have to do is just read 2 books, not very bulky, very thin books, maybe together 350 pages. And those things are when you read that Raftery book, you will say that, okay, these things I already know. All you have to do is just do a quick brush up of your surgical anatomy, physiology, pathology, and do the MCQs from that eMRCS, and you can easily crack this Part A exam. Okay, so there is no special as such different preparation. 15 days a month is all you need to crack MRCS. Okay, Punjab colleges ranking, Shubham, Punjab, in the Punjab, Chandigarh, okay, that's Sector 16, Government Medical College, Chandigarh, that is good. Okay, so after Chandigarh, if you get like CMC, Ludhiana, that is good. Government Medical College, Patiala and Amritsar, they are like almost like each other. But yes, Chandigarh is obviously better than the other, the government colleges in the Mumbai. Delhi versus Mumbai, which is better? Okay, this is a debate which is like since when I was taking surgery at that time, the debate is there. So if you are from Delhi or the North India, go for Delhi. Delhi is better. If you are from that, the Central India part, Mumbai is also good. Okay, like KEM there, that is good. SAIT GS, that is good. So these colleges, I will not say that there is very much difference, and I will not say that, okay, Mumbai is better in this or Delhi is better in that. But my personal opinion, if you ask me, Delhi colleges I feel is better in the form of like the, first of all, the stipend is better in Delhi. There is no bond in Delhi. These 2 things where the Mumbai is lacking. The recent, machinery, the infrastructure and the advancements, they are equally good in both the areas. Okay, so considering no bond and the better stipend and I would say maybe a better quality of life in the Delhi colleges, I would go for Delhi as my personal preference. See, 18,000 rank Ishan, after a year drop, do I have a chance of getting any good DNB institute? See, Ishan, believe me, if you are getting any DNB institute, and I'm sure you will get, just take it. Take it from any DNB institute, just do it, enter, do your work, at the same time, start reading. These days for the MCH, you don't have to read anything special. You have to read these things only which you otherwise read in your MS surgery curriculum. Okay, that Valiant Love, Sebastian Schwartz, these 3-4 books are there which you'll read, and your entrance will be based on these books only. Okay, so if you're getting 18,000 a DNB seat, just go for it. Don't drop for one more year, and believe me, you will be doing very great in this. Color blindness is a problem in MS. Okay, yes, this is a real problem. Color blindness, coarse tremors, fine tremors is okay. Okay, little bit of tremors everybody has, but coarse tremors, color blindness, no surgical branch. Okay, don't take ENT, eye, gynae, surgery, take a medical branch. Color blindness, coarse tremors, no surgical branch. BHU versus Mumbai, you are from Nagpur, Shravani, go for Mumbai. Go for Mumbai. Okay, BHU is basically, obviously we all know it is in Varanasi. Varanasi is one of the core cities of the UP. And if you're from Maharashtra, there is a bit cultural difference in UP and Maharashtra. You will feel a bit weird being a Maharashtrian in the UP. So I would suggest go for Mumbai. 22,000 rank in the internship. Satya, I think you should take one more attempt for MS. Okay, Satya, one more attempt for MS. Choosing central, see Ram Kishore, you're from South India, so taking the central institutes like BHU, not very difficult. Okay, I have seen from my institute also, there were so many people from Orissa, from South India. In the initial 2-3 months, you will have a little bit of problem in interacting, but believe me, the seniors are there to help you. They will tell you what you are supposed to ask, and Hindi is not a very difficult language. I mean, basic Hindi, all of us know, obviously being a national language. But talking to the patients and talking to the hospital staff, that you will learn in 1 year. Okay, when I remember there was a girl, she was from Tirunelveli in Tamil Nadu, and she came. She had absolutely very minimal idea of the Hindi, but by the time she finished her 3rd year, she was very fluent and she was very confident in talking to the patient, talking to the sisters and the other staff and the seniors and juniors. So I don't think that is a very major barrier. Okay, being a South Indian coming to the North India, Hindi is easy language. People here are not that very accepting nature people they have in the North India. So you're most welcome. Prospects after MS without MCH. See, after the MS, suppose you don't want to do MCH, you can join as a faculty in medical college. Okay, there are so many medical colleges, government medical college, private medical college, so many upcoming. Okay, every day some minister is announcing they are going to open these many medical colleges in this state and that state. So obviously when they are opening so many colleges, they need faculty also. So this is one option. And suppose you like academics, you want to be attached to the academics. So this is something which you will enjoy your whole life. Okay, then you can work in a private hospital or corporate hospital. You can have your own setup. Now this is something which will take some time. Okay, don't think that after 3 years of MS you will open your own nursing home and you will be like performing surgeries. After MS you have to give maybe 4 or 5 years somewhere to learn. Okay, because that basic learning will continue even after your MS for 4 or 5 years. You'll get your confidence after working for that much time, and then you can open your own setup. And suppose your father or somebody in your family is having your own setup, then you can go and take it over and you can run it very nicely. Okay, so these are the options. So believe me, after MS, so many people are doing so well. Okay, you can have a fellowship. Okay, easy fellowships like minimal access fellowship, bariatric surgery fellowship, okay, solid organ transplant fellowship. Okay, Okay, robotic you can do. So there are so many things there which you can do after MS. So MCH, like many people, you will hear from so many people that after MS, MCH is must, MCH is must. There is nothing like must. Okay, suppose you want to go in corporate hospital or in private hospital, corporate hospital mainly, then yes, MCH is required. Although they have their general surgery department also, but yes, you will get preference in the corporate if you have MCH. Otherwise, in the medical colleges, the salary for the general surgery is also same, and the super specialty is also same. There is not much difference. Which is the best place to do fellowships? Okay, see, if you are getting a fellowship outside India, that is better. And for fellowship, remember, there are few fellowships which are like for few days. Okay, like FIAGS, FMAS, FACRSI. These are like 3-4 days. They will teach you. They will take a simple exam. This is not good. The fellowships which are good, this is for like 1 to 2 years fellowship. These are the better fellowships. You will get a recognized degree also in these cases. Okay, that degree is recognized by the National Medical Council, the State Medical Council. So these fellowships are good. Okay, so don't go for like few days or a month fellowship or 3-month fellowship. That is not, that is maybe a kind of, it will look more, your visiting card will appear more full and so many lines will be there under your name. But that is more of a fancy kind of fellowships as compared to like 1 or 2 year wala fellowship, which is obviously has some weightage in your, in your curriculum, in your this thing, CV. Getting Delhi colleges at within 1300, definitely you will get. Definitely, I can give you in writing, you will get in Delhi. Prioritizing between Central Institute versus Delhi versus Mumbai versus Stanley. Stanley is very good college. Okay, if you are from Tamil Nadu, if you are getting Stanley, stay there. Okay, if you are getting Stanley, be there, Ramkishore. Okay, it is MMC, Stanley, very good colleges. I have friends there. So I would suggest that you be there. Okay, at 2000 rank, there are chances that you will get MMC Stanley. Other than Delhi, Bombay for 3 to 4,000 rank. Other than Delhi, Bombay, UP colleges are good. Okay, Delhi, Mumbai. Then UP colleges are good. PG AIIMS Rohtak is good. Okay, Gujarat colleges. Okay, BGMC is very good institute. Then Rajasthan, SMS Jaipur, Jodhpur, these are good institutes. Financial scenario after doing MS. Okay, actually this I did not want to discuss too much about the colleges here in this session. Was not actually about which colleges you should go and which state you should go. It is more about what are the different prospects after as you are asking, so I am answering few of these things, but asking the order of preference and these things, that was not the main purpose of this session. It is about telling you that if you are thinking about surgery, then just close your eyes, go and do surgery. An amazing branch. I have no passion for surgery being a girl, so should I still prefer gynae and obs? Priyakshi, see, if you don't have a passion for surgery and if you have worked, obviously you have worked and you went for your surgical, your postings in Obs Gyne department. Being a girl, Obs Gyne is any day a evergreen branch, and the name and fame and the money which you get from gynae is never going to going into a downfall. It is always an evergreen branch. Yes, Obs Gyne is a bit bit hectic as compared to, you ask me medicine, derma, these branches, ENT, Obs Gyne is obviously a bit hectic. But in Obs Gyne, suppose in future if you don't want to do surgery, suppose you don't like surgery, okay, then also there is so many things. You can do consultations, you can go for IVF. So there is a wide spectrum after doing Obs Gyne. If you don't want surgery, then you can quit doing surgery and just go into these things, IVF and all. Scope after fellowships versus MCH in corporate hospital. See, Minal, these days there are so many fellowships which people are doing after MCH. Okay, so if you ask me about MCH and fellowship, which one is having more weightage in the corporate? This one is having more weightage. Obviously, this one is having more weightage. And if you do MCH along with fellowship, that is obviously something more. After MRCS, can I do MCH from the UK? See, after you do the MRCS, when you go to the MRs, after doing your MRCS, when you go to the UK, they will be posting you in some of the subspecialty only. Okay, like maybe they will put you in hepatobiliary pancreatic unit, maybe they will put you in some transplant unit, maybe they will put you in some urology. So you will be, after MRCS, when the people go there, they will be working in a particular department there. Okay, not as a general surgery department. That is rare. Mostly you will be given some subspecialty there. Work-life balance is, like I said, Dheeraj, it is totally depending on the person who is doing. Okay, so you have to love your job and at the same time you have to have this work-life balance. That is very important. Okay, if you ask me, a very amazing surgeon having no personal life, that is not something which is known as success to me. Okay, if you are a decent, good surgeon and a person who gives time to the family, also the parents, the spouse, the kids, that is something which I say is successful life. Okay, so that is totally dependent on you. Okay, few people, they are too much into your patients and the hospital that they forget about that they have a home also and the people waiting there. So that, but in surgery, I have seen so many surgeons who are having amazing family life. They have time for the kids. Like in the initial maybe 3 years or maybe 3 years more when you do the MCH or the residency, that time you will have to give more time to the hospital. But after that, maybe that is the period after the MS people, they get married and that is your initial family period. By that time, you will be free from those long duty hours and other things, and you can easily balance your work and life. So this is absolutely doable, and surgeons, they have the beautiful personal life also. Yes, medicine prodigy, if you're from Kerala and you're getting other better colleges like MMC Stanley, VMMC, MMC over the government colleges of the Kerala, obviously you should go for it. Okay, just step out from Kerala. There is the world is too big, and you will feel nice after working 3 years somewhere like outside the Kerala. It will be very good environment. People these days, most of the areas, the people are very receptive and they are very friendly. They will treat you very nicely. So obviously you should go for it. Sheetal, if you have if this question is in your mind that you can be you can go for OBG or surgery. If you are thinking about this, then believe me, go for OBG. Okay, OBG is a part of surgery is OBG only. Okay, in OBG also they are doing so many surgeries, and they are after doing, suppose after you do 3 years of Obs Gyne, if you feel like your inclination is more towards the surgery, then you can go for subspecialties like you can go for gynae oncology, you can go for even surgical oncology you can do as a Obs Gyne. But if you have this doubt about surgery and Obs Gyne, go for Obs Gyne. Anesthesia and UCMS is, yes, I have friends there in anesthesia and UCMS. It is good. So many cases, variety of cases, and the workload is a bit there. Anesthesia people are also quite busy, and they are, in fact, I feel they are more busy than the surgery people, because daily they have either ICU or the OT, and after you enter in the OT, coming out from the OT and going to the canteen and going to these things will be difficult. So, but yes, anesthesia is good in UCMS. Punjab colleges for surgery, Shubham, believe me, they are not as good as the Delhi, Mumbai or the Haryana colleges. Okay, so Punjab surgery, apart from the Chandigarh, the other districts, the surgical training as well as the expertise is not as good as in the other states. Color anomaly for red grain, don't take surgical branch, Manmeet. Anesthesia at UCMS or Tata or KEM. See, if you're thinking about anesthesia, then Tata is something which I won't suggest you to go, because in Tata, if you'll go, what kind of surgeries you will be doing, or what kind of patients you will be getting there is mostly the malignancy patients, as compared to if you go to maybe KEM or the UCMS. There you'll have cardiac patients also, you have neurosurgery patients also, you have plastic surgery also. So in the anesthesia, you should choose a branch which have multiple specialties as compared to maybe only cardiac surgery or the only oncology. So that's why I think that UCMS KEM is better than Tata for anesthesia purpose. Okay, as your father is ENT surgeon, Ishank, and if your father has his own setup, then I would say that you prefer ENT over general surgery. But suppose he's also working somewhere and you don't have your own setup, and you don't have plans of opening your own setup, then you go for general surgery. But if you have plans of getting your own ENT center, then yes, it is quite a good, it will be a good decision for you. Surgery in AIIMS, Gautam, AIIMS is always a premier institute, and I'm not saying that the surgery in AIIMS is any less as compared to the other areas, but in AIIMS is more of research oriented, and being in a surgical branch, the hands-on you will get in AIIMS is quite less. The workload will be equal or even a bit more as compared to the other areas, but you will have the feeling of a surgeon, but your hands-on will be a bit rusted. But that you can anyway compensate after you finish your 3 years of PG. You can join any other government institute, and you can learn that in 1 or 2 years. Okay, but getting the tag that you have done the PG from AIIMS, that will always help in wherever you go, wherever interview you go. It will always help. So if you're getting surgery in AIIMS, whatever AIIMS, go for it. It is not a bad thing. He has a private setup, Ishant, then you should not sit in this session. Okay, then the things are very clear for you. Go take ENT. Okay, private setup, your father has nothing you should think about. If you're getting DNB orthopedics in a corporate hospital and you wanted to take ortho only, then yes, there should not be any doubt. Okay, Vinay, go for it. If you are having tremors when you are anxious, see, anybody will have some tremors when you are anxious. Okay, people I have seen, so many senior surgeons at the time of surgery, if there is any bleeding, if there is any major injury, even their hands I have seen getting tremored. Okay, so that is not a problem, but it should not be for every purpose, for everything you have coarse tremors, then that would be a bit difficult. Okay, otherwise that kind of tremors is done. See, no matter what kind of rank you have, all of you, this is my request, try for INICET. Okay, the counselings, they have not yet announced the counselling schedule. All of you go for INICET, try for INICET. Okay, I have seen people are getting, not very good rank in NEET, but they get amazing rank in INICET. Okay, so this is not the time to stop. You have studied for so long, just 1 more month and give INICET with your, the full potential. Surgery versus orthopedics, or pros and cons. See, orthopedics, the pros of the orthopedics is it is an end branch. Okay, after 3 years, you're done. You don't have to give any other entrance, any other. In orthopedics, there are certain fellowship in spine and the other things, but believe me, even a simple orthopedics is also good enough. Okay, but surgery is something like, if you ask me about earning money, okay, being in a private setup or being something, more than an orthopedician, a surgeon who is like, suppose, a urologist or a surgical oncology, the earning capacity and the glamour is more in surgery as compared to orthopedics. But if you think that, okay, you have read enough and you don't have the you don't want to give any other entrance exam, you just want to get it done, get it finished, then take orthopedics. What to do if someone is more into research, Yatin? Then you go in these institutes like AIIMS, PGI, JIPMER. These institutes are, the top institutes which think about research. So if you are more inclined towards research, even after you are doing your MS or DNB from some other institute, you can join in these institutes as a research fellow. Okay, so these people, they always welcome the people who are more who have more interest towards research. Very high myopia is not really a big issue, but yes, very high myopia is something, either you can get it a bit better or corrected by LASIK or something. Otherwise, yes, surgical branch is something which, like while doing surgery, many times if you have specs, you feel a little bit of obscure vision can occur. So very high myopia, I would say that if you're not very much want to become a surgeon, then choose some other branch. Does doing surgery from AIIMS help in MCH in any way? Gautam, yes, in one way it helps, because when you do PG from AIIMS, when you give INICET for super specialty, in INICET for super specialty, AIIMS people, they if you want to go in AIIMS Delhi or in any AIIMS for MCH, they have one institutional review also. So if you want to go to PGI or JIPMER, they will simply your rank and you can go. But in AIIMS, they have their internal assessment. So when they have their internal assessment, that time, if you are a AIIMS postgraduate, they will prefer you. So that is one advantage if you have done your PG from AIIMS. That is how it helps in MCH, especially if you want to go again in AIIMS for MCH, then it helps. Otherwise, if you are preparing for NEET SS, then it is really does not matter much. This is what I am saying. First you do 3 years of MS and then choose then you decide, then you'll actually you will understand, and actually you will realize that in which branch you want to do the MCH. Okay, so first 3 years of MS and DNB, MS or DNB, and then you can decide at which branch you want to go for. Yes, guidance. See, seniors are your teachers. Seniors and patients will be your teachers. Okay, your actual teachers will be also your teachers, but your interaction with your guide or with some senior professor will be very less as compared to what you interact with your immediate seniors. Okay, you will be doing your most of the things. You will be having your breakfast, your lunch, your dinner, everything with your seniors only. And seniors are the people who will be telling you that, okay, this is how you will put some ICD, this is how you will take suture, this is how you will make discharge, this is how you will talk to the patient, this is how you will take consent. So all the basic learning which you need to acquire in your post-graduation will be taught by your immediate senior or the next senior. Okay, so obviously seniors are your main teachers. Tell about the monetary for MS and every super specialty. See, Yatin, if you ask me about the financial gains after the surgery, see, it totally depends on where you want to go. Suppose you want to be in a medical college, then obviously whatever you are getting, the pathologist will also be getting at the same pay, the microbiologist, the other departments. So there in the medical colleges, the pay is equal for whatever level you are. Okay, but if you open your own setup, this is where the surgeons have the maximum advantage. If you open your own setup, okay, there you have the money. Okay, you are working under someone else as compared to you open your own setup, and maybe after few days you will be hiring few surgeons to work under you. That is a totally different level. There the sky is the limit. Okay, it will be very difficult for you to count the money which you are getting from your own setup. Okay, but getting your own setup in the big cities like Delhi, Mumbai is difficult because these areas are already saturated. So many corporate hospitals, so many good government hospitals are there. So getting your own setup in Delhi is not very practical. But yes, when you go a little bit like 100 kilometers from Delhi, 150 kilometers like Meerut, this side Aligarh, and here in the Haryana, these areas like surrounding, when you go in the suburb area, that is a more fertile area to have your own setup, and you can do all the surgery, just take the laparoscopic set, and then you will do lots of things. Yes, MS ENT is confined and limited surgery options, but more inclined towards general surgeries, specifically to CTVS. So if you're thinking about CTVS, one thing I want you to tell is go to a hospital, talk to the people who are doing CTVS there. They will be the better person to tell you about the CTVS. Okay, so but like you said, your father has his own ENT setup or for ENT. Okay, because at end of the day, your satisfaction as well as the money which you are getting from the thing which you are doing, if both the things are matching, that is the best thing. Okay, and obviously if you love what you do, then only you will get the money. Otherwise, you take the top branch but you don't like it, the money will also not come, because if you're not liking it, you will not be good at it, and if you're not good at anything, then obviously there will be financial problems also. And if you're good at something, you love something, people, pathologists, they are earning so much, the microbiologists, the other branches which you don't find it to be very glamorous, they are earning lots of money from it because they love that branch. Okay, but in UCMS, I know people from UCMS, they are doing these procedures. Okay, maybe as such a different urology department is not there, but they are doing urological procedures. So they are doing most of the procedures there. Okay, and for those things, suppose they don't have a dedicated oncology. For oncology, you don't need anything special in the anesthesia. But suppose for neurosurgery, they will send you somewhere for getting the neurosurgery experience. So those institutes who don't have those subspecialties in the anesthesia department, they'll send you to maybe for 3-4 months to those areas where you get the experience from those subspecialties. Okay, 6-year courses, Gautam, I have already spoken about it. Okay, so I guess it is like 8:17. So it was really amazing to talk to you, all this discussion. That is toxicity is no Rishikesh, there is no toxicity. Okay, toxicity is very relative term. Okay, subjective term. Okay, if I ask you, okay, give me this thing, and you find my tone maybe a bit different, you might call it toxicity. Okay, I have seen people, maybe the seniors in the initial few days, they will, because they want to train you. Okay, you're going from your MBBS to a post graduation, so obviously you need a bit training. So if you think that training has toxicity, believe me, that is not going to help you. Okay, you will not like what you will be doing, and like I said, you will be spending most of your time in hospital. So if you feel that it is a toxic environment, it will look toxic. But if you feel it as a learning opportunity, as something which surgeons are used to, and then you will find it, even if it is really toxic, you will enjoy that, feeling that environment. Okay, so thank you very much. And if you are on the DAMS exclusive club, then you can tag me in the DAMS exclusive club. Okay, otherwise you can you can message me on Telegram or on the Insta also. You can have your doubts, you can ask me your doubts. Okay, so I am so very happy for all of you who had got ranks in this NEET PG exam, and I'm sure all of you, those who want to be a surgeon, just go ahead, and believe me, that is surgery is one of the most amazing postgraduate branch. Okay, so 22,000 rank in internship. If I don't get the same rank next year, that's feeling. So why Satya, why do you think that you will not get a better rank than this next year? Obviously this time with your internship you have got this rank. Next year you will be more focused about your studying, and believe me, from 22,000 maybe next year you will be within 2,000, and then you will get a very nice government medical college. Okay, so that is just 1 year of life, and in long run that 1 year is nothing. Okay, so don't be in a rush. Okay, this was your first attempt with the internship. You can take one more. CMC Ludhiana Shubham is better as compared to DMC Ludhiana. CMC Ludhiana is better. Okay, so thank you very much. I'm signing off, and I wish you all the very best. So just one last thing. Okay, there is a book by Finite and Infinite Game by James P. Cars. So that is finite game and infinite game. What is the difference? Finite game is a game where there is a winner, there is a loser. Like once you give, suppose you are giving your entrance exam. So there is like either you clear or you don't clear. Okay, there is some result. Infinite game is the one where you will be entering now when you go to the PG. Okay, where there is no winner, there is no loser. You are in the game, you are playing that game because you love that game. Okay, so every day you play, every day you win, every day you lose. You will feel as if you are winning, you will feel as if you are losing. But believe me, you are not losing, you are not winning. It is just a game. You are playing this game for the sake of game, because you want to push the game forward. And this is what is life all about. Okay, so welcome to this infinite game. And I hope you play this game with all your full effort, and you enjoy this game, and I'm sure you will enjoy this game. Okay, so thank you very much, and wish you all the very best for your future endeavors.